morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we are talking all about scars.
Scars, okay.
What are scars? Let's get into it. But first, we are sponsored again by the amazing Fairgrounds, a cafe right across the street. Amazing matcha today. I have a matcha cortado with banana cold foam on top.
Wow, sounds really fancy.
I know, what do you have?
Earl Grey matcha latte.
Yummy. Cheers.
Cheers.
Whoa. This banana cold foam tastes like a banana cream pie. Do you like banana cream pie?
Yeah, I love it.
Oh my
I'll get
gosh.
it next time.
Every time we post a video, people always say, what about the scar?
When we make an incision, there's going to be a scar. There's sort of no way around it. A scar basically is your body's amazing way to heal an incision. Just think about all the trauma you've had throughout the years, fallen down, got a cut, got a scrape, and your body heals itself. So the repercussion, though, is there is a mark, scar, if you will, of where the trauma was. So basically, it's your body's ability to heal that incision cut penetration of your skin in an amazing way, but the residual is that it leaves a scar.
I mean, I think it's a fair trade.
Absolutely.
Yeah.
I mean, if the wound is left open, it can lead to infection, it can lead to then further tissue loss, you can get really sick. So it's amazing how the body can keep the wound clean and then heal up that wound.
You do really big skin removal surgeries because these people lose massive amounts of weight, 100 plus pounds a lot of times. We even have people that lost 400, 600 pounds.
Yep.
So there's no way else to get rid of that skin without a scar.
Yeah, there is no way that we current technology have a way to get rid of the skin without leaving a scar. To remove the skin, you got to make a cut. And when you make a cut, it's going to leave a residual scar. So scars heal by progression. Okay, so there's an open wound. Your body reacts to it by causing inflammation. Blood pours into the area, comes out through the capillaries. All these healing factors go into cleaning up the wound, and then it goes into repairing the wound by making collagen in the wound and bringing the wound edges together.
Okay, and this process takes about how long for a scar to heal?
So the closing of the wound depends on many, many factors: the size of the wound, the depth of the wound, health of the patient, etc. But those usually heal up within about 1 to 2 weeks, depending on the wound.
And when you say that, do you mean like that's when it's probably not going to bust open?
Probably not.
Okay.
These are big generalities. Depends on many, many factors, but in general about 2 weeks.
Okay.
And then the body goes in and it constantly is repairing the wound. It goes in and exchanges the collagen for one type and another, makes it stronger and stronger, and then usually after about a year, that's usually about as good as it's going to get.
And then you always say that scars take 2 years to fully form.
Yeah.
So what does that mean?
The body's always repairing it. It's always making it better and stronger to a point. It can never be 100%, but it gets to be maybe about 97% in terms of tensile strength, the ability of your body to stretch that area and the area to maybe perhaps open up.
I've seen some patients where I can barely see their scar.
Yeah.
Why is that?
Yeah, it depends on your age. The younger you are, probably the better the scar is going to heal. To the point where, there are many studies now repairing wounds, scars in utero, and there's no scar. So there's something about stem cells and babies and amniotic fluid that leads to basically no scars. So the younger you are, the less scarring there is. The younger you are definitely has a factor. Genetics definitely has a factor. The type of wound definitely has a factor. The type of repair and closure really factor into this. The amount of damage, the amount of radiated skin, the amount of maybe radiation in the field, all these contribute to a scar.
You really put an emphasis on making sure you suture these really well and that people heal up as well as possible. How do you do that? How did you specialize that?
Massive weight loss patients are not just like a mommy makeover. No, these patients have been obese. The skin's been stretched out for years. Sometimes the skin's been stretched out extremely, maybe because their gastric bypass ruined why they're anemic. Maybe they have all kinds of metabolic dysfunctions due to their stomach stapling, and they usually don't heal as well as patients who have just lost weight or patients that are coming in for maybe liposuction. So, part of it is many, many layers of skin closure. It's not just 1 or 2 layers with very, very small suture, or not just gluing the skin together as people think. And then also you need to be aggressive on the amount of skin you take out.
Why do some scars fade better than other scars?
So it really depends on many, many factors again. It depends on your genetics, how you heal. It also depends on ethnicity.
Are certain people genetically predisposed to form thicker scars or keloids?
Yeah, so there are patients who are genetically prone to getting thicker scars or those keloid scars. But in general, really, it's kind of random. I think it's probably related to the gastric bypass itself and not forming these hypertrophic scars, in addition to the way we suture and the way we treat wounds after the surgeries. Yeah, in my practice, 25 years, we had basically 3 patients that had keloids. One came in with keloids from a C-section and had a tummy pretty much close to her knees and said, look, I want to get rid of my pannus. We did a tummy tuck paniculectomy, and she did get a keloid, but she did have a history of keloid. But she said, I definitely trade my pannus, excess skin and fat of the tummy area, for a keloid any day. So she was okay with her keloids.
What is a keloid?
Basically, a keloid, by definition, is a scar that grows outside the boundaries of the normal scar. Okay, so you get a cut, okay, you get an abrasion, and a keloid basically is excess scar tissue outside the boundaries, where it just kind of mushrooms outside the normal confines of the scar. It's very thick and it's very bumpy.
Okay, so we just talked about keloids, and a keloid is a type of scar?
Keloid is a type of scar, yes.
Let's touch on the other types of scars.
Yeah, there are basically 7 different types of scars. There's your normal scar, okay? You have an incision, a trauma, and the body heals it up. That's a normal scar. Then you can have a hypertrophic scar, which is basically a little bit of excess scarring. You have a scar and your body overreacts to it by making more than normal scar. And then you can take that to the extreme where you have a hypertrophic scar. You can have a normal scar that overheals. And a normal scar that overheals, that's what's called a keloid. Okay. Again, that's a scar that grows outside the boundaries. Okay. Then you can have an atrophic scar. It means you have loss of tissue underneath the scar. So maybe there is like an acne scar or maybe like a chickenpox scar where there's a depression, a loss of tissue, loss of fat underneath the scar. So typically those scars have depressions. Then you can have stretch marks, okay? Stretch marks usually are rapid weight gain and subsequent maybe rapid weight loss where the skin's been stretched out like a balloon and a lot of those elastin and collagen fibers break, and then sometimes they become pigmented because of changes in hormone levels, and they can become stained, and then you lose the weight. Contracture scar basically is a scar that contracts. You ever noticed you have an incision and it's sort of gaping open? You're like, how is that going to close? Well, the body sends muscle cells to that area, one at a time, lines them up, and pulls the edges together. In contracture scars, once the scar is healed, the body is like programmed, for some reason we don't necessarily know why, to still contract. So if you have a linear scar, and it's like a tug of war. So if you have an end and I have an end, we're pulling, but actually the body is contracting. It's pulling those edges together. And as it pulls those edges together, you get this band, okay? So typically you'll get the band like in the armpit, but it can happen and usually in any flexor crease. So sometimes you can get it in the neck from burns. You'll get a contracture band, which brings the neck down. Sometimes you can get it in the face where it brings the contracture, but it's a band like a rubber band of scar tissue that's contracting down. And the last scar is a surgical scar. So you have surgery, we make an incision typically with a scalpel, and we open you up, fix you up, and then close it. That's a surgical scar. So those are the 7 types of scars.
A common misconception is your stretch marks are an indicator of how your surgical scars will look.
Incorrect. Stretch marks, again, are a disruption of the skin. The skin's been stretched out like a balloon, and all those little fibers have been popped and busted. Surgical scars, we're cutting through the skin, so it's different.
If someone were unhappy with their scar, any of those that you mentioned above, will you be able to do something about it?
Depends. Usually, yes. I mean, plastic surgeons, we specialize in scars. In the hospital, too, we work with a lot of scars, whether, they're burn scars, traumatic scars, scars from maybe treatment like mastectomies, surgical site scars.
And what can you do about these scars if someone's unhappy?
Application of silicone. Silicone is a great element that can help mature the scar. It can help flatten the scar. We don't know exactly why silicone is the best, but we found through our studies that silicone is the best in terms of the gel, silicone gel sheeting, which is a sheet of silicone you put on the scar. It really helps to flatten out the scar and also get rid of the pigment. So there are topicals you can do, or maybe it's hyperpigmented and you want to get rid of some of the discoloration. There are creams we can apply to get rid of some of the pigment. If there are veins or discoloration in the scar, there are a lot of lasers we can use to get rid of sometimes the purpleness in the scar. Sometimes we do surgical excisions where we cut out that scar and we're trading one scar for another. Sometimes we'll do little zigzag Z-plasties to break up the scar, like contracture bands, where you have a linear scar and we make a zigzag on it. to make a Z-plasty.
And that interrupts the band.
Interrupts the band.
Okay.
Instead of the band pulling, we're making a little zigzag, so you're...
To release the tension.
Exactly. So you're pulling that way, and I'm pulling this way, and it disrupts the band.
How often are you doing scar revisions on your own surgeries?
Pretty rare. I mean,
Yeah.
I'd say less than 1%.
Yeah.
Pretty much on most of my patients, we use dissolvable sutures, multiple different types, multiple layers. We use compression. That helps to minimize the swelling, minimize the tension. It also helps to flatten the scar. And then also after the surgery and everything's healed up, that's when we use the silicone cream and the silicone strips. And with that modality, scar revision treatment is pretty low.
I feel like you do more scar revisions on other plastic surgeons' work than your own.
Yeah,
like
so,
a lot of people come in and they're
yeah.
like, can you revise this while you're in there?
Yeah, so typically we'll have, patients that have a tummy tuck or maybe breast work or arm work done elsewhere, and they're like, can you revise the scar? And usually we can revise the scars. Another modality to treat sometimes, especially like keloid scars, is sometimes we'll actually use radiation.
Oh.
Okay. We'll send you to the hospital or an outpatient radiation clinic, and we'll radiate the scar to help shrink that scar down. So other things we can do for the scars, we can inject things like steroids, like Keloid, and another product called 5-fluorouracil. It helps to break up the collagen and minimize the scarring.
And I'm just trying to understand. So if the keloid is up like that and then you're injecting it, does it just kind of flatten?
It shrinks down.
Like it shrivels up? Or?
It shrivels up.
Okay.
It shrivels up.
Mm-hmm.
A lot of activity going on, and your body it doesn't get the off message.
Yeah.
It doesn't get the message, well, we're okay, it's healed. So you go in with steroids, and steroids decrease the inflammation, decrease your body's mechanical cellular work to help that scar to heal. It tells it to stop, basically.
Can keloids be cut out, or does it depend on the area? Because it does seem like a lot of times there's a lot of tension on those areas.
Yeah. With the keloid, you're trading one thing for another. Mm-hmm. If you excise, cut out a keloid, and then stitch it back together, that keloid may come back, and it may come back even worse than before.
Oh, boy.
Because again, it's another cut.
Yeah.
It's sort of a balance.
Okay.
But keloids are also prone, genetically prone, and also more prone in certain areas, okay? So like the earlobe can get them, keloids.
Oh, yeah.
Shoulders, because it's moving around a lot. It's different kind of skin, okay? So shoulders and ears get keloids quite a lot. Sometimes on the tummy you'll get the keloids, but not as common as typically shoulder and earlobes.
Can tattoos successfully camouflage scars, and is that something you recommend?
There are medical grade tattoos and there are non-medical grade tattoos. So maybe it's an artistic or a cosmetic tattoo. And then there are the medical grade tattoos. Medical grade tattoos, a person that's specialized and certified in medical tattooing.
As camouflaging? Or?
As camouflaging, okay. So that what they'll do is they'll match the pigment of the surrounding skin to that scar. And they'll actually inject pigment. We've seen some amazing results with medical grade tattooing. If you're concerned about your scars, I can refer you to medical grade tattoo artists that are really amazing. They do amazing work, especially in the breast. Mm-hmm. Typically with like breast cancer reconstruction, they can make almost 3D nipple areolar complexes for patients that have had complete mastectomies.
We're going to have to wrap this up soon, but why do scars carry such an emotional weight for some of our patients?
For some patients, it's sort of a badge of, look at my journey, look at my weight loss journey.
Right. Literally battle scars.
Battle scars.
Yeah,
yeah, exactly.
And the last question is, have you seen scars become a source of pride and empowerment for these patients?
Absolutely, okay. So these patients, instead of you're thinking, well, maybe I'll just cover up the scars with, long sleeves, long pants all the time. No, these patients are wearing tank tops, showing off their arm scars, maybe bikinis, showing off their tummy tuck and body lift scars. It just really depends on the patient.
Well, if you have any questions about your scars, please call us up, 310-859-7770, or you could DM us on Instagram.
At Dr. Katzen MD.
And if you are going to get surgery, just know that your scars will probably be fine. You probably won't have to do anything with them, but there are a lot of precautions we do to minimize the scar.
Like the sutures we use, the compression garments that we use, the silicone cream that we use, and the silicone gel sheeting that we use. That should get you a really good scar.
Yeah. Oh, last question. How long do scars have to stay out of the sun?
Typically, I'd like them out of the sun for about a year.
A year.
That doesn't mean you got to stay inside. That means if you go outside, maybe you have a cover up, maybe down to the wrists or maybe down to the ankles.
Or you have the strip on.
Or the strip on, or maybe an SPF to protect it from the sun, maybe at least 50 or higher.
Just to give it the best chance of healing?
Yep, because that scar is basically like baby skin. It will burn easily. It will become pink and nasty for at least a couple of weeks if you get a sunburn.
Ow, that sounds painful.
Don't do it.
Okay. All right. Well, thank you guys so much for joining us. Plastic Surgery 90210. Thank you, Fairgrounds, and have a good day.
Cheers.
Cheers.
Cheers.